So for my synovial joint, I chose the elbow joint. I first made the femur just because I wanted to make sure that it came out properly because I made it out of clay and then I had to bake it for an hour. I also used blue clay just to show certain landmarks and just other spots that I wanted to be able to show a little bit more. So I did the greater tubercle and the lesser tubercle and the medial epicondyle and the lateral epicondyle. And I also used a hinge-like metal piece, so this will hopefully attach them properly. And now I'm going to be starting to make the ulna and the radius. So I just finished making the ulna and the radius. As you can see here, I tried to landmark as best as possible with the grooves and everything. I also put the blue clay on just to make it stand out more. I couldn't make the ulna as predominant as I wanted it to be just because it is clay and it dries, and I wanted it to stick it into the humerus afterwards. And I also added a little hook to help with the movement with flexion and extension. So I still have to label that one. I'm just finishing up labeling the humerus. So I have the head and the greater tubercle. The deltoid, I tried to make it look like the actual bone as much as possible. And I had to cut off a little bit of the trochlea, however you say it, just because I have to stick the radius and the ulna inside of it, and it was getting a little bit in the way. So I'm just going to finish up labeling this, and then I'm going to label the ulna and the radius, and we'll see how it turns out. So this is my humerus. This is the posterior side, and this is the anterior side. It's the left humerus. So what it does is, it's called a long bone, and it connects the shoulder to the lower arm, and to make the elbow, it connects to the ulna. So I have here in the green the bones and the landmarks. So I guess I'll describe those for you. So in the proximal region, there is the head, which projects medially, and it's connected to the tubercle by the anatomical neck, right around here. There is the greater tubercle, which is laterally, and it's an attachment site for the shoulder muscles. The lesser tubercle, which is on the anterior side, over here, it's smaller, and it's medially located on the bone. So separating them is a long, deep depression, which is the intertubercle groove right here. And at the distal end, there is the 3 depressions. So on the posterior side, we have the lateral and the medial epicondyles. So this is the lateral and this is the medial. They're the 2 projections of the bone, and there also is 3 depressions. So there's the coronoid and the radial and the olecranon fossa. So the olecranon fossa is this deep depression here, and then on the anterior side there's the radial fossa and the coronoid fossa. So on looking at the bone landmarks, there is in the proximal region the head, which projects medially, and it's connected to the 2 tubercles by the anatomical neck, which is around here. So looking at the tubercles, there is the greater tubercle, which is laterally, and it's an attachment site for the shoulder muscles. The lesser tubercle is right here, and it's a lot smaller, and it's medially located on the bone. Separating them is a long, deep depression, which is right here, and that is called the intertubercular groove. And then there is the deltoid tuberosity, and that's another projection, and then parallel to that is the radial groove. At the distal end of the humerus, there are 3 depressions, the coronoid, the radial, and the olecranon fossa. So the olecranon fossa is this deep depression here, and that helps the forearm from doing the movements at the elbow. And then the other 2 are the coronoid fossa and the radial fossa. So there's also on the posterior side the lateral epicondyle and the medial epicondyle, which are another 2 projections of the bone. At the distal end, there is the trochlea, which I had to cut off a little bit part of it just so that the bone can connect to each other. And then lateral to it is the capitulum, which is over here, and that articulates with the radius. So some muscles include the coracobrachialis, which is located around here on the humerus. It's an agonist muscle, and it helps to flex and adduct the arm. Another muscle is the deltoid, which is located around here. It's another agonist muscle, and it helps with medial and lateral rotation. There is the biceps brachii, which is located on the lateral side, and it's a supinator and flexor of the arm. And then there is the triceps brachii, and it's an arm extensor. There is the brachialis, which is located around here, and that is a pronator and an arm flexor. There also is the brachiordialis, which is the elbow flexor, and it also runs through into the ulna and the radius.